All right, welcome everyone tonight. We really appreciate your attending tonight's town hall. This is an important part of the process that we're going through right now. And I know it's always a chore to attend meetings at this time of the day. We all have busy schedules, so we really appreciate your being here today. I'm Dane Allen. I'm on the board of Lehigh. I was elected in 2022. I just completed my first year. And with me at the table here is Diane Champion, who is also on the board and has actually served on the board, I think, 13 to 14 years. So she's got me by a few years. But we both represent, we're both part of the District 4, which is what Lehigh Acres is in. So Diane and I do represent the residents of this district, which is why we're at the podium. We have a few other directors here who I won't introduce that represent other districts. This is the first town hall of 6 that are going to be occurring over the course of the next week around the county. So we're looking forward to more of these. We really encourage feedback, questions, feedback, concerns. That's a big part of the process. It's why we're here. It's why Dan and I are sitting here. We want to hear from our fellow citizens of the county. We have important decisions that will be up for consideration, and it is very important that we get whatever feedback we get. The format tonight is going to be largely a presentation by Larry Antonucci, the CEO of Lehigh, along with Michael Hashow. Can't remember if anyone else is going to be speaking for the management team.
Well, we'll have them in for some Q&A.
So, without further ado, I'd like to introduce Larry Antonucci, our CEO. He will take over.
Thanks, Dane. Thank you all for being here. I do appreciate the time, as Dane said. I do want to just acknowledge our board members that are here.
Larry, I'm so sorry to interrupt. Diane, would you like the opportunity to say hello to the audience, being that we are in Lehigh Acres and this is...
I already shushed them. Welcome, everybody. Glad to see your happy faces.
Sorry.
No worries. I just wanted to acknowledge our board members that are here. David Klein is here. David, our chair, Don Clark.
Thanks for being here.
Our vice chair, Therese, don't stand up.
I can do it. Welcome, everyone. Thank you.
And Kathy Rich Lyles.
Hi. Welcome. Thanks for being here.
And I think that's it. Right? We're good. Well, again, as Dane said, we want to hear what's on your mind and what your thoughts are. And what we want to do is really talk about what this process is about, kind of why we're here, what the evaluation is, what it looks like, what it's likely to tell us. And then we'll talk a little bit about the different structures that we're contemplating. Michael, then we'll talk about the process and the timeline that's been outlined by the state. So if we go to the next slide, one thing that's important to remember is the fact that we've been here since 1916. We have been proudly independent, nonprofit, self-supporting health system that has grown from a 4-bed facility back then to where we are today, one of the largest systems in the country. Local mission with a regional impact, locally led and governed. We are a critical safety net organization. And that means we take care of anybody regardless of their ability to pay. And that's very important to this community. It's something that it's important that we continue. We provide a very wide array of care. We've got over 100 sites throughout the county, and many of you, of course, have seen them or been there. As I mentioned, one of the largest public health systems in the state, if not the country. We are the top employer in Lee County, a trusted provider, and of course, we're a major economic engine in this community with close to 15,000 employees. So what we'll talk about is what we're evaluating and why. Where are we in the process? Then we'll have time for questions, and then we'll also give you some information on where you can access the latest information. So let's just talk historically a little bit. As I said, 1916, the Lee Memorial Hospital was established. It was established as a community-based not-for-profit, and it ran that way for 50 years until the mid-60s, when the Florida legislature established the district the Lee Memorial District as a unit of government. And we've been operating as that way since the late 60s. During that time, we've seen tremendous growth. As I mentioned, we've provided tremendous benefit to this community. Literally billions of dollars have been reinvested in the community because as a not-for-profit, every dollar that we make, we reinvest back into the community. And that's allowed us to do things like build the Children's Hospital, build 4 acute care hospitals, a rehab hospital, et cetera, along with the many, many sites around. We provide over $140 million of care to the community, unreimbursed care, community benefit, every single year to this community. That's something that's very important that we continue to do that. As we got into the late 2010s and 2019s, obviously the healthcare landscape is changing and evolving, and we're seeing significant transformation in healthcare. One of the big things that happened in the state of Florida in 2019 was the repeal of the Certificate of Need law. Now, for those of you who are familiar with that, what that meant, it was a law that operated for many, many years, and it only allowed hospitals to be built if there was a need that you had to show to the state. In other words, you had to apply to the state and say there is a need for a hospital in this particular community. If there wasn't a need, the state would reject it. So we continued to operate under those rules until 2019. Now, when the state repealed the Certificate of Need law, one of the things they did is they didn't put any requirements on any hospital that could be built. So you, for instance, could build a hospital that didn't take Medicaid, which is the program for the poor, that didn't take a share of the uninsured, which we do now, and it allowed that potential to occur. So as we began to look at the landscape, we realized that yes, there will be competitors in this community. There will be other hospitals and other hospital systems. I can almost assure you of that within the next 3 to 5 years. And how is that going to affect our ability to continue our mission to be that safety net provider and to maintain local control? So one of the things we began to explore is that how can we compete? We're not afraid of competing. We've competed in the past, but we want to compete fairly, and we want to compete on equal footing. One of the things that competitors will be able to do is act regionally. We're restricted in what we can do to the confines of Lee County, and that makes it more challenging. So we began a process where we approached the legislature and asked if we could expand our borders of our district and allow it to work more regionally so that we can compete more effectively. It became clear after a couple of years of doing this that the state legislature was simply not going to consider that. They really did not want to deal with special hospital districts in changing enabling that. And what they said is, well, if you want that type of flexibility and you want other flexibilities that would occur, you should consider becoming a community-based instead of a government-based health system. So they passed a law last year that is permissive. In other words, it allows us to evaluate it. And that was very important to us. We didn't want to be demanded to do anything. We didn't want to be forced to do anything. We simply approved and supported the flexibility to say, this structure that's been in place for 60 years, is it the best structure for us to continue to be that safety net provider? Because that's what is most important to us, is to be that safety net provider and to be locally controlled and locally managed. So that led to our board of directors voting to at least do the evaluation. Now, the evaluation is quite prescribed by the state. It requires us to bring in an outside independent third party to do a 6-month evaluation. We've chosen Kaufman Hall, which is a national healthcare consulting team with broad experience throughout the country, and especially in this type of evaluations. And they're in the process of providing that report. That report will come out sometime in February, no later than the end of the month. And that will look at all the various factors, the pluses and minuses. Does it make sense to do this? Does it not make sense to do this type of conversion? So, no decisions have been made. The board has not made a decision. The administrative team has not made any decisions or any recommendations regarding conversion. We're simply in an evaluation stage. And the purpose of being here tonight with you is to describe that process of evaluation so that if you have any questions about it, we want to cover those with you. So what we know today, so let's look at the comparisons of what we're talking about when we talk about a special district government health system, which is what we are today. So it maintains a strong focus on and a commitment to its longstanding mission of caring for every Lee County resident. And again, that would not change if we became community focused, a nonprofit health system. Quality and safety, leadership and staff maintain strong commitment to provide every patient the best care and experience possible. Again, would not change. Our margins would continue to be reinvested back into the system and the community to improve care for patients and the overall health of the community. Again, that would not change. Contrast that to a for-profit hospital or a private equity hospital where the profits are returned to the shareholders. That's how that would work. Charity care, we maintain a strong focus on and commitment to the mission of caring for Lee County residents, patients in need of care, regardless of ability to pay. Now, one of the things that's unique about us, about a public system, when the legislature passed the law in the 60s creating this special district, they did not give us taxing authority, which is highly unusual for a public safety net system. If you're deemed to be responsible for caring for the poor, just about every other large public system has the ability to levy a tax to support that, whether it's an ad valorem tax on your real estate holdings or it's a sales tax. We've never had that. So we've operated without that sales tax authority since the mid-60s. So again, in the last bullet, Lee Health does not have taxing authority today and has never depended on the local tax to support our day-to-day operations, and this would not change if we converted. So that would remain the same. Obviously, as a non-governmental entity, we would not have the ability to tax. So let's go to the next slide and talk about the differences, because there are some clear differences between the two structures. So, in our current system, we have an elected board. Board members are publicly elected, and you see that on the ballot. Every 4 years, they serve 4-year terms that are staggered. In a nonprofit, community-focused system, our current board, according to the law, the current board can stay on and serve on the new board, but then as they attrit off, they would have a governance committee and they would self-select the other board members. So it would be a self-governing or a self-perpetuating board, I should say. That's how the board would move on first. Business practice governance, currently we're governed by our Enabling Act and Florida law applicable to public entities. In a new structure, it would be governed by the Florida law applicable to not-for-profit corporations. And as you know, we have many not-for-profit corporations that serve the community very, very admirably. We have organizations like Salus Care, like Goodwill, like the Salvation Army, etc. Those are all not-for-profit, community-based, or private not-for-profits. Our growth and expansion, as I mentioned earlier, we're limited to Lee County by law. So we cannot operate outside the county. So it really restricts our regional impact, our economies of scale, and patients have to suffer because they have to travel longer distance to see us if they're coming from our neighboring counties. With a community-focused nonprofit system, we would have the option to grow beyond Lee County, to meet the needs of the region, to reduce the burden on patients, and achieve greater economies of scale, and also to diversify our revenue to support the things that we need to do and want to do within Lee County, to preserve that safety net mission, the ability to care for all patients regardless of their ability to pay. Now, one of the big changes that we would see if we were to convert is that we would lose sovereign immunity. So sovereign immunity limits negligent lawsuits to a government agency and has caps on damages. It exists to protect public funds that help cover the cost of providing services. That would no longer be present if we changed our structure. So we would have to insure. We currently carry insurance for negligence over and above sovereign immunity limits, but we would have to modify that. The important thing is that we would provide that insurance to protect our staff. So our staff, whether it's our nursing staff or our physicians, would always be held harmless for any type of negligence claims that would come in the future. So those are the main differences between the two structures. Let's go to the next slide. So now I'm going to ask Michael to give us a rundown of what this process looks like. It's a very elaborate process, and as I said, it's very prescriptive by the state. The state has outlined exactly what has to be done and what should be done. Michael?
Thank you, Larry. If it's all right with you, I'll just stay here in place and we'll talk about it. Though now that I see you turning your heads away from the screen, maybe that doesn't make sense. Sorry about that. Okay, so to discuss this very deliberate process that was authored in the enabling legislation prescribing the amount of time this should take. One, it is set to take longer than a year. The evaluation process started on August 31st when the board had selected the vote to move forward and do the evaluation component of it. So that started on 180-day or 6-month clock. The latest that clock could run to, as Dr. Antonucci said, is February 27th of 2024, so the end of next month. In that evaluation phase, we're waiting to have a completed report returned to us in the board of directors, and once that completed report is returned to the board of directors, assessing where the system is today and where it might be at the end of this process if the board elects to move forward, they'll have 120 days to review that information. So as you can see in the second gate, after the phase 1 of evaluation, you would start the phase 2 of discernment. And in that 120 days, the responsibility is to examine the evaluation report and identify the structure that provides the greatest benefit to the residents of Lee County. And the Lehigh Board of Directors will act to either pursue further the conversion and start phase 3 or end the process with no changes to the system. In the phase we're in today, you see the first check mark there. We have not yet completed step 2, which is to conduct a public hearing. The enabling legislation only requires one public hearing to be held. This board of directors went well above and beyond that mark. We have scheduled these 6 community town hall meetings, of which this is the first of the 6 right here in Lehigh Acres, and we're excited to be here. Should have led with thank you so much, everyone, for attending. And then second, to receive the evaluation report at the end of the phase. So after these 6 town hall meetings, which will conclude next week, 6 business days in a row, the board will continue its series of having governance workshop meetings and regular discussions on this topic. We've had a number of internal town halls to collect information from the medical staff and employees around the system and hear from them about what they're thinking and what they'd like to know. And once we enter that second phase with the report in hand and they're doing that discernment, if they elect to start the next phase and pursue phase 3, that would start another 120-day clock. So keep in mind, after February 27th or at some point in February when they receive the report, it starts 120 days when the report is received. And then at the absolute latest, after receiving the report in 120 days, they have to make a decision whether to move forward or not. If they elect to move forward, that starts yet another 120-day clock. And in that 120 days, they would work to structure what this new community-focused nonprofit would look like and work with the county commission to have them agree upon that enforceable commitment to the people of Lee County. And so in that last 120-day phase, which at a maximum would end on October 24th of 2024, the Lehigh board and the system must negotiate the terms for the agreement, and then a final 2 votes would need to occur. One by the Lehigh Board of Directors, and that would be a supermajority vote. That's 7 of 10 if 10 are voting, and a majority vote of the Board of County Commissioners. And so all told, you can see just how deliberate and stretched those phases are to allow for participation in the process and to share this information. And we look forward to hearing what you all have to say about it. I think on the next slide we might start the Q&A.
Mm-hmm. Thank you. Thanks, Mike. All right. Fire away. What questions do you have? Concerns?
How big is the new region going to be?
We don't know. Yeah, I think it's just a matter of flexibility.
Is it gonna go south, east, west, north?
It could go anywhere. I mean, if we became a private or a not-for-profit that was community-based, we wouldn't have any restrictions. take, for example, Tampa General. Tampa General was a public system, just like Lehigh, and it converted in the 90s. And now Tampa General has facilities in a lot of different parts of the state.
I'm just curious, you're gonna take the money from the league and put it into another region of the state?
Well, I think the way I would see it is that we would take money from other parts of the state and put it in the league. Any other questions? Don, you have a
Yeah,
comment?
I wanted you to let them know how they can access the report, because when we get the report, it's public.
Yeah, we're gonna do
We're
that.
elected,
We're gonna do that.
So
Yeah.
the public would have access to it, and everybody in this room would have access to it. So you have the same information that we have.
Yeah, all the information is on the website, and at the end, we're gonna put up the website address for you, where all the information is regarding any of the analysis that's been done. Yeah, way in the back.
I believe currently there may be a planned expansion into Lehigh Acres for a future potential hospital of some kind, clinic or something like that. In the new structure, would that continue?
Yes, absolutely. Our commitment to Lehigh is strong. We recently purchased some property on Homestead, and we're making plans for that right now. I think we're going to start initially by putting a mobile unit on it, to at least get some providers there, to begin seeing patients with plans to put a structure, put a facility. But yes, no, that commitment will change. Let's go back. Yeah.
What is your annual budget?
Our annual budget, it's 2.8 billion to 3 billion, depending on.
And you're saying the board would be self-perpetuating and it would just continue to so your salaries would go away, right?
My salary?
No, the board members.
No.
It's not for profit, they can't take salaries, can they?
I can take that. So the board of directors had voted earlier this process during a governance workshop that they would accept no additional compensation beyond what they received today in the public entity, is the answer to the question.
And have you explored interlocal agreements with other agencies? I know you have LESAR.
LESAR is a wholly owned partnership with Sarasota Memorial.
Yeah.
So
that
it's not
didn't.
intergovernmental. It wouldn't be intergovernmental.
Okay.
Let me go in the back right there. Yeah, that's you.
I want to tag on to his statement about having something in Lehigh, the clinic,
Yeah.
and doing it quick. Last week, our grandson, who was 10 years old, we thought, had problems with his appendix. We had to drive all the way to Gulf Coast, which is an hour in this traffic, and then he had to go to the Golisano. You know, I mean, a long time ago, we now have over 100,000 people in this area. And, you know, if you're going to be representing and sitting there telling us this is all Lee County needs to start recognizing, you know, Lehigh more than they have in the past. And it's not just about the hospital.
All right, no, I appreciate it. Absolutely. Yes.
I'm going to assume by the discussion that this wouldn't impact anyone's insurance, even whether they're on Medicare or Medicaid.
That's correct, yeah. From a patient's perspective, it'll be pretty transparent.
Okay.
You're not going to really see any difference in how we're operating. And similarly, from our staff's perspective, I don't anticipate there will be much.
Two more questions.
Yes.
Do you see that this will help enhance the ability to recruit doctors? Because I know in some specialties there's huge waiting times to get in to see doctors.
I don't know if it's going to have a significant effect on them, other than the continued viability of the system. I think, you know, physicians want and providers want to be associated with strong systems.
Mm-hmm.
And I think anything that can make us stronger will be attractive to physicians. And again, so cut to the bottom line, what we're talking about is what is going to be the best structure for this system to continue to provide safety and care forever,
Mm-hmm.
you know, and maintain local control at the same time. And that's the question we're trying to answer. We don't have an answer yet. We're waiting for the answer.
Are they still planning to build a hospital on Challenger?
Yes.
Okay. And I just want to say that one of the reasons we moved down to Lehigh was because of the health.
Okay.
We've had excellent care and we have some critical issues in our family, so
Yeah.
thank you.
Well, thank you for saying that, and that's something we want to continue.
Your question about the doctors is one I hear all the time. I mean, access is one of the biggest complaints about Lehigh Health. Not that Lehigh Health is doing something wrong, but just we've had such growth. Just trying to keep up with that growth is a major pain point for lots of people, including us, people that are insiders, including employees. If we get bigger, what will happen in some of the specialties is we'll have enough patients to actually go 2, 3, 4 deep. Right now, a lot of the subspecialties, you got to send people to Miami or send people to Tampa. Okay, you have cancer, you go to Moffitt. Okay, we will not have to do that as we get bigger.
Thank you. And the people that are specialists there are fabulous. I can
Yes.
name a few, but I won't.
Yes.
You mentioned before about patients billing, and I have 2 bills here that changed recently because of this transparency. My one bill here was about $5,600, but they had an adjustment of $4,900, which is an 88% reduction. And then I had a second bill, which was over $12,000, but they also had a reduction of 88%. What is this adjustment?
I can't say, just.
Yeah, I'm sure.
Yeah, no, I understand. But what I'm gonna ask you to do is get with Mary.
Pat, could you get his information?
Yeah, and let's get that information for you. We'll get you an answer. We'll find out exactly what that is.
No, I know it's like the billed fees with the insurance companies, and can we get to see those contracts?
That's a question for Mary. Where's Mary?
Yeah, that,
I'll talk to you, Mary.
okay, all right.
Yeah. Thank you.
Could you say who you are, Mary? I'm sorry, Mary McGillicuddy, General Counsel for Lehigh Health. Nice to be with you.
We have more than one Mary.
And not to be confused with Mary Briggs.
Any other questions? Yeah.
So right now, in order to change your legislation, you have to go to, has to be voted on by the public, right? So 10 years from now, if you're a not-for-profit corporation, you can just change it as long as it complies with the not-for-profit statute.
Mike, you want to get that? You're a government expert.
Yes, sir. No, so right now, the Memorial Health Systems enabling legislation, it's a political subdivision in the state of Florida. It was created by the legislature. So they have the ability to amend that enabling legislation, which they did. The authority created in the enabling legislation established this process for the conversion or not. But no, we don't need to go to the voters to make that change.
Well, no, I mean, in the future, as a not-for-profit corporation, you have a town meeting, right?
I'm sorry, I couldn't hear that over the.
10 years from now, you're a not-for-profit corporation. You can change your rules and your terms and conditions at any time.
No, so the enforceable commitment with, which is part of this enabling legislation, right? The commitment that is going to have to be explicitly put in the contract for the delivery of services for the people of Lee County, that will not be amendable.
And the contracts with the Lee County Board of Commissioners.
Yes, sir.
Just as a follow-up, because I think I might have heard you ask something else. So once it becomes a private if it becomes a private nonprofit,
Correct.
it actually dissolves the current structure. So the enabling legislation goes away.
Mm-hmm.
So there is no coming back to a public entity that is currently more a public nonprofit. Does that help you?
Yeah. I mean,
Yeah.
Becoming a private nonprofit, is there any amount of federal dollars that you currently receive that you would no longer receive?
Yeah, that's very possible. That's one of the things that we have to look at. And that's one of the key ingredients that Kaufman Hall is looking at is what supplemental payment programs through the Medicaid program will we continue to receive and which ones would we no longer be able to receive. So that will be definitely part of the calculus as we study this.
And the last question, how much was this Kaufman, how much did this, we'll call it a feasibility study evaluation cost?
Mike, do you remember?
Yes, sir. $900,000. Director Martin.
Just a follow-on the question of downstream changes. The enforceable agreement could have terms and conditions in which limit what the not-for-profit can do. It could require us to go back to the county government, for example, to do something, or to report to the county government. And there's a level of restriction and accountability, which is possible, if not guaranteed. It's a matter of negotiation. Is that correct?
Yes, sir. And that, bring it back.
What involvement would Lee County have with the new entity as far as board members, as far as decision-making, as far as any of that is concerned?
So the law allows for the current board members to continue to serve on the board of the new entity. Subsequent to that, though, the board would self-select members in the future as other not-for-profits do. So they would most likely establish a governance committee. They would identify the areas of expertise that they would want to have on the board, and then go out and try to recruit that talent to join the board.
And one other question, how is this going to affect, like Lee Physicians Groups and some of the other entities that aren't actually in the hospitals?
The Lee Physician Group are actually part of the Lee system, so they would remain so and become part of the new entity.
Thank you.
Yes.
Okay, so we got stay the course, go to what you proposed here. Is there a third option you're considering, going to profit?
Well, actually, if you look at the situation, you can lay out 4 different options for the health system. And let's paint a picture, okay? Let's say that a competitor comes to town and begins to provide services in high margin areas, places where they can make a lot of money. And they're going to do that and provide that in areas and not do the kind of things that we do, right? They're not going to do the low margin business, they're going to do the high margin business. If that were to affect our bottom line to the point where it was a serious threat to us, we would have 4 choices. We could continue in the current structure and try to do the best we can. We could go to the public or go to the county and ask for taxing authority. It's a heavy lift in this community. We could sell the system. Today, the board of directors could vote to sell the system. And the sale could be to a for-profit company, and that company would not most likely provide the level of service that we provide. Or the 4th choice is the conversion choice. So that's, again, I can't anticipate that something like that would ever happen, but I think we're talking about maximum flexibility.
Is there any way to go to a Medicare for all system throughout the United States?
Yeah, that's way above my pay grade. A single payer system is something that's been talked about for a long time. Whether it will ever occur or occur in our lifetime is really hard to predict.
We're the only industrial country that does that.
I understand. Believe me, I grapple with it every day. When you deal with,
Our healthcare system is the lowest.
yeah, well, our outcomes are not where they need to be nationwide. We have some serious issues that we need to deal with. Any other questions? Yes.
Hi, just one more thing. With the insurance contracts that you have with the different insurance entities, would that be affected, or would it just remain what it is and you would recontract on an annual or biannual basis, whatever it is that you contract with?
That's what I would anticipate. Yeah, we would just as the contracts renew, we would just renew them. Mary, we go
That's correct.
speaking.
You're correct.
Okay. And we're gonna make sure.
We pay taxes for the next, when you go private.
No, we'll be a not-for-profit, and so as long as we demonstrate the community benefits, which we do every year, as I said, we provide a report. In fact, the report is here if anybody wants to see it. That we provide over $150 or so million in net benefit, net of whatever taxes we make. So we would not have to pay that.
How much profit do we make on that $3 billion that we have coming?
Yeah, our margin last year was 1.7%. Pretty soon. Before that, it was a little higher. We like to budget about a 5% margin. That's our goal, and that's what we need to fund the capital projects that we see over the next 5 to 7 years, including here in Lehigh, right? So if you take just replacement capital, where it's every year just to replace the things that we have to replace, new X-ray machines, new beds, et cetera, new computer equipment. costs about $100 million just as a baseline. Over and above that are the dollars that we invest into the community. And we anticipate that number to be about $750 million over the next 5 to 7 years. But we've got to generate a 5% margin to be able to do that. Now, the dirty little secret about hospital finance is that the majority of our patients, their reimbursement doesn't cover the cost of care. So the Medicare program, the Medicaid program, that reimbursement doesn't even cover the cost of care. That cost is borne by the privately insured. The privately insured are paying about 200% of cost, and that's just a hidden tax. And that's how the system is operated for a long time.
Well, isn't everybody privately insured?
No. No, I mean Medicare and Medicaid are government programs.
No.
No?
Private insurance companies,
Medicare,
like United Healthcare.
Medicare Advantage, that's a different program, but it's still funded by the federal government.
No. All Medicare programs are basically private insurance that the government pays for, Medicare Part A, B, C, and D. They're not basically run by federal employees. Okay? They go out, they hire, like United Healthcare is the largest in the country. And I think you deal with United Healthcare, well, Blue Cross Blue Shield.
Well, we're getting into a semantic discussion, but probably not.
They are private.
Okay. And that's the back there. Yes.
When you become a non-for-profit, are you looking for additional income streams like donations, sponsorships, that kind of stuff?
Well, first of all, we haven't decided to become.
Oh, yeah, I mean.
But if it were to happen, we have an active foundation right now. Chris Simino is here, he's our chief foundation officer. And we generate about $20 million a year in philanthropy. And I would see that continuing. I wouldn't see that continuing. Yes.
How would that affect the employee that work for income?
How would
The change?
A conversion?
Mm-hmm.
It would be pretty transparent. I can't imagine they would see any change. We have Mike Wookich here, our Chief Human Resource or Chief People Officer. Mike, you want to comment on that? There's a couple of slight issues.
Yeah, it's fairly negligible with one exception. We have two retirement plans, a 403B, which would likely stay the same, and we have a 457B, which is currently held in trust. Under the conversion, if we were to convert, that would become an asset to the hospital, which under the unlikely circumstance that we went bankrupt, that asset could be part of, the total assets of the organization. But the likelihood of that is relatively low, but it's there. That's really the only change that we've been able to identify. And I've come from other nonprofit systems, community-based nonprofit systems. Went through a sale of one. It's really negligible to our staff.
Yes.
You're having these town hall meetings and hearing the HR guy talk. Have you guys talked to your own employees to see how they feel about this?
Yes. We've had town halls open to the entire staff. And not only our staff, but our physicians. We've had a number of town halls there, and then another one for our independent physicians too.
So anytime there's change, as I said, we took our grandson and we had impeccable service, and everybody was just, their morale was real good, and they're very friendly and they're helpful. In change, you don't want that to change.
Without a doubt. Without a doubt. You're right. Yes, in fact.
What about the buildings, the hospitals, the brick and mortar? I said, become just automatically asset, or because right now it's government owned, so how is that going to work?
Mike, do you want to take that?
Yeah, so it's part of the evaluation process and how you, in that transition, how you cover the cost of that physical asset and by the delivery of care to the people of Lee County, and that's part of the enforceable commitment that we discussed earlier. So if you value Lee Health at whatever Kaufman Hall comes up with, but let's say it were $2.8 billion as an annual operating budget, as Dr. Antonucci had said, then you're committing to a $2.8 billion worth of care delivered back to the community. And that's how the asset is transferred to this new community-focused nonprofit.
Including the buildings?
Yes.
You want to explain more about the enforceable agreement, what that is?
Yeah, absolutely. Thank you, Dr. Klein. So the enforceable commitment is was the legislature's intent in creating a process that largely models after what happened with Tampa General in the 1990s, and that was creating terms that were acceptable to the people of Hillsborough County at the time in their situation, that ensured the delivery of care to those residents. And some of those covenants are things like you will have a children's hospital, or you will offer this service or that service, and you will do it as long as the entity exists. And those are the types of commitments we're talking about, and that's how the transfer of that physical asset occurs. And remember, important to note, is that in the creation of this district, there's never been a tax to pay for, right? So it's not as though the residents are taxed to pay for the district, so that's a nuance of this.
Yeah.
Has the county staff or county commissioners or for state representatives at all, has anyone stated their opinion on this matter at all yet?
Well, thank you. So the legislature did, by voting affirmatively to create the authority, they've not come out and said one way or another. I think that both the Lee County Board of County Commissioners, the Lee Health Hospital Board of Directors, and any elected officials are all waiting to see the findings of the report to make a determination, which I believe is reasonable.
What is your market share here? Because I'm hearing you say you're afraid that people will come in and compete with you. The only other hospital I know of, like in Lehigh, is 88 beds. How many beds do you have? What's your share of the market?
Well, first of all, I never said we were afraid of competing. I said we're very happy.
Well, that's the way I read it.
As long as we can compete on equal footing. We currently have 1,800 licensed beds, I believe, so we have the majority of the inpatient care. But we don't have a majority on outpatient care, ambulatory surgery.
So that's like 95% of the beds.
Yeah.
I went to the artificial intelligence, and I began very, very profound. I asked them what questions to ask. I have 13 questions. You answered practically every one.
So, do I have some real intelligence then?
Engagement, nonprofit status, government, financial transactions. Okay.
Thank you.
Staffing, patient satisfaction.
Yeah, wait a back.
What are some of the negatives that you've been hearing out there? If you were to play devil's advocate in this situation, could you give us some of those? And I know that they're sort of a moot point in a way almost because the actual study hasn't been done.
Right.
But can we hear about that a little bit?
Sure. Yeah, I think. Well, one of them I think you brought up is that would be the loss of some governmental funding. We really have to look at that. The other is how we would handle our current debt. We were able to put bonds out as a governmental entity, so our borrowing costs might change. We would want to definitely look at that. The loss of sovereign immunity I mentioned is something that we would have to insure against, so that's something that would be a cost to us. So there are a number of that's why this is a 6-month evaluation. This is not simple. There's a lot of issues that have to be looked at to really weigh whether this is the right thing to do and the right time to do it. That's another question.
Can anybody name any more?
I'm sure they can. Can you think of any? Or
well, yeah. As we continue to do the fact finding in the report and any issues that we might find or uncover, there are specific nuances to like the government funding mechanisms that Dr. Antonucci mentions. Things, supplemental Medicaid payments programs that are funded with something called an intergovernmental transfer, and how those things might occur that continue to finance that safety net mission. So the goal of this is, if it were to go forward, you cannot do it unless you can find a way to make that safety net mission work. I think that making sure we maintain local control of the system and making sure that the system is financially viable to deliver care, whatever that model looks like. In this process, there are 2 options when you complete it. The votes affirmatively to decide to stay with the system as today, or votes affirmatively to change the governance structure. But those are the only two options at the end of this process.
I wouldn't mind following up on that if I may.
Yeah.
I know that something I'm hearing a lot about is our current structure. We are a nonprofit also, right? So we are a governmental entity, and we are a special district based on Florida statute. So you have an elected board, and everything is done in the sunshine because it is a community trust. So if we do have to convert to a nonprofit private entity, this district will no longer exist, and it does not have to be in the sunshine. So their meetings will be just like any other private nonprofit board meetings and strategy and discussion. So that's a concern I've heard quite a bit.
Okay, so then the question becomes, how do you ensure that the best interest of the community, should this be allowed, is covenantally bound?
You want to talk about enforceable commitment?
Yeah, so I think that the best I can say at this point is we have a very clear example in a system that was able to successfully do that. I can point to two systems in Florida today, in Orlando Health and Tampa General, that have commitments to their communities that are safety net hospital providers, and they're 501c3s, and they are not government hospitals. And so I think there's a clear path for being able to accomplish it if that's the choice that's made. But it is also clear to note that this is not as simple as there's a right and a wrong answer. There will be things to give and things to gain if whichever choice you make. To affirmatively choose to not change is making a choice. And that choice in and of itself will have positives and negatives. So,
since we're no longer going to have elections on the board, and this board is going to be self-perpetuating, is there any safeguards, oversight that they have to answer to?
Yeah, you can talk about like what they did in Asheville.
Right. So that's something that will certainly be worked out directly with the county commission when you decide on oversight for that system and those covenants that must be met. Right. But there's also federal law and state law. There will still be an annual community benefit requirement of that system for its not-for-profit status. It will still be, because of the Affordable Care Act, it will still require a community health needs assessment. There will still be a number of metrics that require the information is published and available to the public on the website of the system.
Yes.
A few years ago, maybe quite a few years ago, you guys tried to do a sales tax increase to get money for you. Would this new entity make it easier for that to happen?
No, I don't think so. I think we'll prohibit it. Yeah.
Oh, you wouldn't be able to do it then?
No, we would not be able to do it now. Correct me if I'm wrong. A local community healthcare tax could be voted on by people that would support whatever hospitals happen to be in the community. I think Palm Beach does that, right?
Yeah. What you'll notice,
we wouldn't be able to apply for it to tax.
Right. As a non-union government, there will be no taxing authority. Today, if we help were to seek a tax because of the way our enabling legislation is written, we would need to go back to the Florida legislature to get the authority and then go to the voters for a referendum. And I'm quite certain that the voters of Lee County enjoy the service without paying a tax for it.
Yes. Bring back.
Can we dig one more time on that? I don't think the answer to the question I asked is that, if it doesn't convert, there's no guarantee it stays in place. It is a safety net. I get that 110%. Actually, it's a pro for converting. So, but if it converts, is there potentially a structure that would shore up the probability that the mission would remain the same as it was intended?
Well, I think, Mary, do you want to, from a legal perspective, just comment on once that commitment is made,
Yeah, I think, and ensuring our current mission to safety net.
Right, so what would be included in that enforceable commitment or agreement? It's really an agreement and a commitment to the community, but we had to have a way to enforce it. And so we needed some kind of governmental entity to oversee it, and the Florida legislature said, well, we're not going to do it. So they came up with the idea of the Board of County Commissioners. So their job is basically to enforce the commitments that are agreed to in that agreement. So there is another entity in another state that had a similar arrangement, and they actually created a separate entity to George, you might want to talk about this too. This is George, not counsel to the board. Had a separate entity that would specifically oversee that and then report to sort of an oversight committee. And that I could envision something like that happening.
But therein lies the answer to the argument that's being important.
They're not like the Supreme Court.
Yeah.
Which legislature or representative proposed this ordinance or this statute?
Which representative?
Or senator? Who was the sponsoring person?
Yeah, so the final bill was passed by House Bill 227, Representative Botana.
Representative?
Botana. Anita Springs.
Anita Springs. 227?
Yes, sir. 2023 legislative session.
Okay.
Yeah. Would the Board of County Commissioners have control over any of the funding or the assets or any of the health itself, or is it just going to be the board that will be in place if this does go through?
It'll be the new organization.
But Lee County's not going to be, like, the Board of County Commission isn't going to vote on different things for you guys or anything like that.
That can't happen, or otherwise we'd still be a governmental entity.
Okay, and that's fine. I just wanted to get clarification on that.
But there is just a brief nuance to the oversight board question earlier. And in the way you operate that safety net mission and finance it, around the state of Florida, you see something called the Local Provider Participation Fund. It's where a 501c3 hospital would pay a dollar threshold to the county government to draw down a federal share of Medicaid to finance Medicaid care in that region. So there will certainly have to be a partnership in working with the county to ensure that we're financing that mission, but they will not control the budget. It will be a mechanism of partnership, if it were to get.
That 88% that I mentioned before, does that mean that the people who aren't insured pay 6 times more?
Yeah, I wouldn't say it's necessarily 6 times more. No, I don't think there's very few people. We'll get into that with you afterwards.
Okay.
But yeah, believe me, hospital financing, I can be here for 3 hours, and you still won't understand it, because frankly, I don't understand it. Yes.
I just would like to get a little bit more clarification about the assembly of the future board. If the board is not going to be elected by the residents of the county anymore. So how can we envision that? So are they going to be appointed? Are they going to be representative from each part of, like Bonita, Lehigh? So how is that going to look like?
It'll really depend on what the new board sets up and what their governance rules are. As I said, most not-for-profits set up a governance committee, and they put forth nominations for members of the board as numbers are needed. Many times the board would have a variable number of members. So in other words, their bylaws would determine that we're going to have between 7 and 11 board members, let's say. And they can then fill those seats as they deem appropriate based on what they feel are the talents and skills that are needed at the board level. So it would be a process that they would control. Yes.
The string back on that, I mean, okay, let's say 9 out of the 11 board members don't like one of the board members. Are you able to forcibly remove a board member too, hypothetically?
I guess it would depend on the bylaws that they establish. I don't know if George or Mary, if you want to comment on that.
It would be common practice with a not-for-profit corporation for that board to have a mechanism for removing a board member.
Yes.
I've lived in Lee County and Lehigh Acres since 1997. And so your recent statement about how you would form the next new committee and who gets voted in because it's not being the community, that would concern me because it's been proven to me since I've been here that if, that Cape Coral and Fort Myers have all the weight, we don't have the weight, and you're gonna, if there isn't a way to make sure we're having representation from Lehigh Acres, that would be very concerning to us because some of the representation we have in county commissioners isn't supporting our area. So not having a system where we make sure that it's being represented of all 6 districts that you have right now is very concerning to me.
I appreciate that. Yeah.
Just to say that geographic diversity could be a consideration that some not-for-profits would do that, right? As part of you heard Dr. Antonucci mention that you might look for certain skill sets that could help inform a board, but geographic diversity, including areas in the county, might be one of those considerations.
I have one more question. Sure. The decision after the report comes out and the whole evaluation process is done, the decision to convert, is that a decision that only the board is doing, or is it going on the ballot?
It's not going on the ballot. The Florida legislature had contemplated that. The year before House Bill 227, there was a statewide version where, and they answered this question affirmatively. If a district collects a tax, it went to the ballot. If it didn't collect a tax, it didn't go to the ballot. And that's the determination they made with House Bill 227.
It's determined by the board of directors, and the board of directors are required to make their decision based on what they determine to be the best interest of the residents of Lee County. And that's where the evaluation report comes in, assists them in evaluating and making that determination. And also, it's where your input tonight is critical. Let the decision makers know how you feel so that they can take that into consideration when they make that determination.
Any other questions? Why don't we put up the slides with the information so you all can stay informed. So these are the other town hall meetings we're going to be doing. We're going to be doing 2 in District 1, one out on Sanibel. And here is,
Can we go back, Larry, to the prior slide?
Sure.
And this is one that I think that I'd like to bring to everyone's attention. There is a public hearing, and that's contemplated in the statute. So if there's something that you think about after coming to this town hall that you want to express prior to the decision being made, you should jot that date and that time down, because it's an open meeting for everyone, and you can have your views considered and acted upon by your elected officials. It's a very important meeting.
Thanks, George.
Yeah.
Okay.
I thought also I saw on the website about a workshop potentially on the 11th.
Yes, there's a governance workshop on the 11th, and as part of the process, we want to go in prepared. We want to understand totally what the issues are, and as part of the process, we are meeting with specialists with respect to governance to discuss some of the issues that y'all have raised regarding what should be in a nonprofit's charter to protect the public.
And that's open to the public, I take it?
Oh, absolutely, absolutely. So if you want to sit in there, you're welcome to come in. We put a sign up at all of our meetings because, as Ms. Everly said, we are a public entity. All of our meetings are open to the public.
We go to the next slide.
I do have a clarifying question to board counsel. I thought at our last board meeting, we discussed having another town hall after the evaluation comes in before we make the final vote.
Mm-hmm. Right.
Yeah.
Right? So, because you had said January 25th is before we make the decision, but we're actually going to have another public meeting after we get the evaluation is what
Right.
you talked about.
January 25th, public hearing. is to kind of wrap up any concerns from the community, for us to listen to their concerns before we even see the report in February. So, at that point, we can also share that with Kaufman Hall and say, these are some other concerns that have come up. We want to make sure where in your report are they covered, so that we get the answers.
And then
that's
there'll
why
be
we
another
want-
town
and then
hall.
After everybody gets the information and has some time to digest it, then in fact, we will have another public hearing with a response if hopefully, most of the questions will be answered by then, but I'm sure there will be other questions that will come up that the board needs to know the community is still concerned about.
So the important website is leehealth.org/looking ahead. That's where you'll find all the resources, all the information, the board updates, the detailed timelines. There'll also be a link, if you don't want to wait till January 25th and you have a burning question that comes up tomorrow morning, you can submit the questions and we will answer any question that you have. And I'm sorry?
The link doesn't work.
The link doesn't work. How do you mean?
You can use the email address, but the link doesn't work.
What link? What link you talking about?
It's on your website.
To submit questions, because we can receive questions.
Okay.
We'll look into it.
Yeah,
We'll make sure
I'll
that it's
check.
working. We'll make sure that it works.
Yeah.
And then plus there'll be frequently asked questions too that we will continue to submit on there. So that's really the place to go to if you have concerns, questions, or want to submit questions. Well, with that, I do want to thank you all for being here, for taking the time. This is very important to the board as you have to make a very difficult decision. This is a big decision for the community and for the health system. So thank you all for being here.